What does the WHO 5 Moments for Hand Hygiene framework specify? A. 5 times per hour that hand hygiene should be performed on every unit. B. 5 key moments: before patient contact, before aseptic task, after body fluid exposure risk, after patient contact, after contact with patient surroundings. C. 5 products approved by the WHO for hand hygiene. D. 5 steps in the correct hand washing technique. The correct answer is 5 key moments: before patient contact, before aseptic task, after body fluid exposure risk, after patient contact, after contact with patient surroundings. The WHO 5 moments are evidence-based indications for hand hygiene that protect both the patient moments 1 and 2 and the healthcare worker and environment moments 3, 4, and 5. They form the basis for most hand hygiene compliance auditing tools. For which infectious condition should a healthcare worker with active disease be excluded from all patient care activities? A. Mild upper respiratory tract infection. B. Active pulmonary tuberculosis. C. Resolved chickenpox with all lesions crusted. D. Colonization with MRSA without active infection. The correct answer is active pulmonary tuberculosis. HCWs with active pulmonary TB must be excluded from work and not return until they are no longer infectious. 3. Negative sputum AFB smears on separate days and clinically improving on treatment. Non-infectious conditions like MRSA colonization alone do not require work exclusion. Which element is essential for an effective infection prevention and control program according to APIC? A dedicated infection control laboratory within the facility. B. Surveillance, outbreak investigation, education, and policy development supported by data and quality improvement. C. A mandatory reporting system for all patient infections to state health departments. D. An infection control physician on call 247. The correct answer is surveillance, outbreak investigation, education, and policy development supported by data and quality improvement. APIC competency model identifies core components of IP practice: surveillance and data use, outbreak investigation, prevention and control, education of staff and patients, program management and communication, and employee health. No single element alone constitutes an effective program. What is the definition of a significant exposure to blood or body fluids in the occupational health context? A. Any contact with a patient known to be HIV positive. B. Percutaneous injury, needle stick, cut or mucous membrane and intact skin exposure to blood, bloody fluids, or certain other body fluids from a source patient. C. Contact with intact skin when wearing gloves. D. Exposure to secretions from a patient with influenza without a mask. The correct answer is percutaneous injury, needle stick, cut or mucous membrane and intact skin exposure to blood, bloody fluids, or certain other body fluids from a source patient. OSHA and CDC define a significant bloodborne pathogen exposure as percutaneous injury or mucous membrane or non-intact skin contact with blood, blood-containing body fluids, or laboratory specimens. Contact through intact skin is generally not considered a significant exposure. What is antimicrobial stewardship and how does it relate to infection prevention? A. A program focused solely on reducing antibiotic costs in the formulary. B. A coordinated program to optimize antimicrobial use to improve patient outcomes, reduce adverse effects, and limit the emergence of resistant organisms. C. A surveillance program tracking antibiotic-resistant organisms in the ICU only. D. A CDC regulatory requirement to limit antibiotic prescribing. The correct answer is a coordinated program to optimize antimicrobial use to improve patient outcomes, reduce adverse effects, and limit the emergence of resistant organisms. Antimicrobial stewardship programs (ASBs) work closely with infection prevention to reduce selective antibiotic pressure that drives resistance. Core strategies include prospective audit and feedback, formulary restriction, de-escalation, and Roman IV to pivot transitions. CMS requires ASBs for long-term care facilities. A patient with active pulmonary TB has been in a shared 4-bed room for 12 hours before the diagnosis is suspected. Which action should the ICP prioritize? A. Screen all unit healthcare workers with PPD immediately. B. Move the patient to an AR, assess exposed roommates for TB exposure risk, and conduct contact investigation. C. Fumigate the shared room with formaldehyde. D. Place all exposed roommates in contact precautions. The correct answer is move the patient to an AR, assess exposed roommates for TB exposure risk, and conduct contact investigation. The immediate priority is to isolate the source AR placement and stop ongoing exposure. Then a contact investigation is conducted to identify all exposed persons' roommates, staff, visitors, assess their risk, and arrange for LTBI testing IGR or TSD. Airborne precautions, not contact precautions, apply for TB. Which of the following best evaluates the effectiveness of an infection control education program beyond knowledge gain? A. Pre- and post-test scores. B. Attendance rates at the training session. C. Observed behavior change and associated HAI outcome data. D. Number of training modules completed per employee. The correct answer is observed behavior change and associated HAI outcome data. Kirkpatrick's evaluation model levels: 1. Reaction satisfaction, 2. Learning knowledge gain per post-test, 3. Behavior practice change observed compliance, 4. Results outcomes HAI rates. Most meaningful evaluation reaches levels 3 and 4, demonstrating actual behavior change and patient safety impact. What does the standardized infection ratio SIR measure? A. The total number of HAIs in a facility per year. B. The ratio of observed to predicted HAIs, adjusted for patient risk factors. C. The infection rate per 1,000 patient days. D. The percentage of patients who develop infections. The correct answer is the ratio of observed to predicted HAIs, adjusted for patient risk factors. SIR equals observed infections predicted infections, and SIR of 1.0 equals national baseline. 1.0 equals worse than predicted. 1.0 equals better than predicted. It enables fair comparisons between facilities with different patient populations. What is confounding in epidemiological research? A. The tendency of subjects to change their behavior when they know they are being observed. B. A distortion of the association between exposure and outcome caused by a third variable that is associated with both. C. The random error in a study due to small sample size. D. Bias introduced by selective publication of positive study results. The correct answer is a distortion of the association between exposure and outcome caused by a third variable that is associated with both. A confounding variable is associated with both the exposure and the outcome, and if not controlled for, can create a spurious or masked association. For example, age is a common confounder in HAI studies. Older patients are more likely to be catheterized and more likely to develop CAUTI, so it must be controlled. What is the most important single action to prevent healthcare-associated infections? A. Wearing gloves for all patient contact. B. Using N95 respirators during all procedures. C. Performing hand hygiene at the correct moments. D. Isolating all patients with known infections. The correct answer is performing hand hygiene at the correct moments. Hand hygiene is the single most important infection prevention measure. The WHO 5 Moments framework defines when hand hygiene should be performed: before patient contact, before aseptic task, after body fluid exposure, after patient contact, and after touching the patient's surroundings. What is the recommended sequence for removing doffing PPE after leaving a patient contact room? A. Mask, gown, gloves, eye protection. B. Gloves, goggles, face shield, gown, mask, respirator. C. Gown, gloves, eye protection, mask. D. Eye protection, mask, gown, gloves. The correct answer is gloves, goggles, face shield, gown, mask, respirator. CDC doffing sequence removes most contaminated items first. Gloves most contaminated. On hands that touched patient. Eye protection, gown, mask, respirator least contaminated. Hand hygiene should be performed after glove removal and after all PPE is removed. Which statistical test is most appropriate for comparing HAI rates between two groups in a cohort study? A. Students' t-test. B. chi-square test. C. Pearson correlation. D. Mann-Whitney test. The correct answer is chi-square test. The chi-square test is used to compare proportions categorical outcomes like infected not infected between two or more groups. Students' t-test compares continuous means. Fisher's exact test is preferred when expected cell counts are small 5. A new ICP notes that the CAUTI rate in 1 unit increased from 1.2 to 3.8 per 1,000 catheter days over 6 months. The increase is statistically significant. What should that ICP do first? A. Immediately report the cluster to public health authorities. B. Verify the data, review whether there were surveillance or documentation changes that could explain the increase. C. Implement a CAUTI prevention bundle without further investigation. D. Conduct environmental cultures of all urinary catheter equipment. The correct answer is verify the data, review whether there were surveillance or documentation changes that could explain the increase. Before acting on a rate increase, the ICP must verify that the change is real and not an artifact of changed surveillance criteria, documentation practices, or population mix. This artifact vs real increase determination guides the appropriate response. Which tool is used by ICPs to identify clusters of HAIs before they become recognized outbreaks? A. Run chart with control limits control chart. B. Scatter plot. C. Bar graph of monthly HAI counts. D. Pie chart of organism type distribution. The correct answer is run chart with control limits control chart. Statistical process control charts SPC, particularly control charts with upper control limits, allow ICPs to detect when HAI rates exceed expected variation, signaling a potential cluster or outbreak that warrants investigation before it is otherwise recognized. Which precaution category requires placing the patient in a single room and wearing gloves and gown upon room entry? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Standard precautions. The correct answer is contact precautions. Contact precautions require single room or cohorting, gloves upon entering the room, gown if clothing will contact patient or environment, and hand hygiene before and after. They apply to organisms spread by direct skin-to-skin or indirect surface equipment contact. An ICP wants to evaluate whether a new hand hygiene product increased compliance rates. Which study design is most appropriate for this QI evaluation? A. Randomized controlled trial with crossover. B. Interrupted time series analysis with baseline and post-intervention measurements. C. Nested case control study. D. Ecological correlation study. The correct answer is interrupted time series analysis with baseline and post-intervention measurements. In interrupted time series, its analysis is a robust quasi-experimental design for evaluating the impact of a policy or intervention. It uses multiple data points before and after the intervention to control for time trends. While not as rigorous as an RCT, it is highly practical for QI and infection prevention research. What is the primary criterion used to distinguish healthcare-associated from community-acquired infections? A. Antibiotic resistance pattern of the infecting organism. B. The timing and setting of symptom onset relative to healthcare exposure. C. The severity of the clinical presentation. D. The age and immune status of the patient. The correct answer is the timing and setting of symptom onset relative to healthcare exposure. HAIs are typically defined as infections that were not present or incubating at the time of admission to a healthcare facility, usually manifesting 4,872 hours after admission, though this varies by pathogen and definition. Which disinfectant is effective against C. difficile spores in the environment? A. Quaternary ammonium compounds. B. Isopropyl alcohol. C. Sodium hypochlorite bleach. D. Hydrogen peroxide 3. The correct answer is sodium hypochlorite bleach. C. Difficile spores are resistant to most common hospital disinfectants, including quats and alcohol. Sodium hypochlorite 1,5-pm and IPA-registered sporicidal agents are effective for environmental decontamination. What is the difference between a cohort study and a case control study in infection prevention research? A. Cohort studies are prospective. Case control studies can only be retrospective. B. Cohort studies follow exposed and unexposed groups forward to compare incidents. Case control studies work backward from cases and controls to compare past exposures. C. Case control studies are used only for rare diseases. Cohort studies are used only for common diseases. D. Both designs calculate relative risk as their primary measure of association. The correct answer is, cohort studies follow exposed and unexposed groups forward to compare incidents. Case control studies work backward from cases and controls to compare past exposures. Cohort studies calculate relative risk ODR. Case control studies calculate odds ratios and are particularly deficient for rare outcomes like rare HAIs because you start with known cases. Case control studies are often retrospective but can be prospective. Cohort studies can also be retrospective historical cohort. An immunocompromised patient develops a fungal bloodstream infection. Which organism is most commonly responsible? A. Aspergillus fumigatus. B. Candida albicans. C. Histoplasma capsulatum. D. Cryptococcus neoformans. The correct answer is Candida albicans. Candida species, especially C. albicans, are the most common cause of invasive fungal bloodstream infections in immunocompromised and critically ill patients, often related to central venous catheters, broad-spectrum antibiotics, and TPN. A patient with HIV has a CD4 count of 105 cells L. For which opportunistic infection is this patient most at risk? A. Herpes zoster. B. Pneumocystis jirovecii pneumonia PCP. C. Oral candidiasis. D. Community-acquired pneumonia. The correct answer is Pneumocystis jirovecii pneumonia PCP. PCP prophylaxis is indicated when CD4 count falls below 200 cells L. At 105 cells L, the patient is at higher risk for PCP as well as toxoplasmosis 100 and disseminated MAC50. CD4 count is the key determinant for opportunistic infection risk and prophylaxis thresholds. A case control study investigating a nosocomial Legionella outbreak finds an odds ratio of 6.3 for patients who used the hospital shower. What does this suggest? A. Patients who used the shower were 6.3 times less likely to develop Legionella. B. The shower is a statistically significant risk factor. Patients who used it had 6.3 times the odds of disease. C. The odds ratio of 6.3 is not clinically significant without a p-value. D. The shower is the definitive source and investigation is complete. The correct answer is, the shower is a statistically significant risk factor. Patients who used it had 6.3 times the odds of disease. An OR of 6.3 indicates that patients who used the shower had 6.3 times the odds of developing Legionella infection compared to those who did not. This is a strong association that warrants immediate environmental sampling of the shower and water system, followed by remediation. What level of reprocessing does a critical medical device one that enters sterile tissue require? A. Low-level disinfection. B. High-level disinfection. C. Sterilization. D. Intermediate-level disinfection. The correct answer is sterilization. Spalding classification. Critical items contact sterile tissue or vascular system sterilization. Semi-critical mucous membranes high-level disinfection. Non-critical intact skin low-level disinfection. Which vaccines are recommended for all healthcare workers according to the CDC? A. Hepatitis B, influenza, MMR, varicella, Tdap, and meningococcal vaccines. B. Hepatitis B, influenza, MMR, varicella, and Tdap. C. Hepatitis A and B, influenza, and tetanus only. D. Influenza and Tdap only. The correct answer is hepatitis B, influenza, MMR, varicella, and Tdap. CDC CIC recommends healthcare personnel receive hepatitis B with titer verification, annual influenza, MMR 2 doses if non-immune, varicella 2 doses if non-immune, and Tdap once, then TD booster every 10 years. Meningococcal vaccines are recommended for lab workers handling Neisseria meningitidis. A researcher conducts a study and finds a statistically significant result with p equals 0.01, but the absolute difference between groups is 0.1. What concept explains why this might not be clinically meaningful? A. Type I error false positive. B. Type Roman II error false negative. C. Statistical significance vs clinical significance. D. Selection bias. The correct answer is statistical significance vs clinical significance. Statistical significance p-value depends heavily on sample size. Large studies can detect trivially small differences as statistically significant. Clinical significance refers to whether the magnitude of effect is large enough to matter in practice. Both must be evaluated together, along with confidence intervals and absolute risk reduction. Which of the following best describes a reservoir in the chain of infection? A. The route by which a pathogen leaves its source. B. The habitat where the infectious agent normally lives and multiplies. C. The method by which a pathogen enters a new host. D. The susceptible individual who acquires the infection. The correct answer is the habitat where the infectious agent normally lives and multiplies. A reservoir is the natural habitat of the infectious agent. It can be human-infected or colonized persons, animal zoonotic disease, or environmental soil, water. Eliminating or controlling the reservoir is one strategy for breaking the chain of infection. What is the significance of the Hawthorne effect in infection control compliance studies? A. Healthcare workers perform better when they know they are being observed, which may inflate true compliance rates. B. Patients become more satisfied with care when infection rates are publicized. C. Surveillance undercounts HAIs because staff avoid reporting infections. D. New hires perform better than experienced staff due to recent training. The correct answer is healthcare workers perform better when they know they are being observed, which may inflate true compliance rates. The Hawthorne effect is the phenomenon where subjects modify their behavior because they are aware of being observed. In hand hygiene compliance audits, direct observation consistently yields higher reported compliance than what occurs in normal practice because staff perform better when they know they are being watched. A healthcare facility must comply with the OSHA Bloodborne Pathogen Standard 29 CFR 1910.1-3. Which of the following is a required element of the exposure control plan? A. Documentation of every patient's infectious disease status. B. An exposure determination identifying job classifications with occupational exposure risk and procedures for evaluating post-exposure incidents. C. Annual OSHA inspection of needle stick logs. D. Training records for all employees regardless of exposure risks. The correct answer is an exposure determination identifying job classifications with occupational exposure risk and procedures for evaluating post-exposure incidents. The OSHA BBP standard requires a written exposure control plan that includes exposure determination job classifications with exposure risk, implementation of universal precautions, engineering and work practice controls, PPE, HPV vaccination program, post-exposure evaluation and follow-up, hazard communication, and training. What does the acronym HAI stand for? A. Hospital-acquired illness. B. Healthcare-associated infection. C. High-acuity intervention. D. Hygienic antiseptic indicator. The correct answer is healthcare-associated infection. HAI healthcare-associated infection replaced the older term nosocomial infection to reflect that these infections can occur in any healthcare setting, not only hospitals. HAIs include CLABC, COTI, SSI, VE, and C. difficile infections. Which federal agency sets enforceable standards for bloodborne pathogen protection in the workplace? A. CDC. B. CMS. C. OSHA. D. The Joint Commission. The correct answer is OSHA. OSHA Occupational Safety and Health Administration promulgates legally enforceable workplace safety standards, including 29 CFR 1910.1030 bloodborne pathogens and 29 CFR 1910.134 respiratory protection. The CDC provides guidance and recommendations but does not have regulatory authority.